Hey everybody, and welcome to another video on pharmacology. In this video, we're going to talk about the thyroid gland and some of the causes and treatments that are currently available for hyperthyroidism and hypothyroidism. So let's begin. What is hyperthyroidism? Well, as you can probably guess from the name, hyperthyroidism is caused by an overactive thyroid gland that's producing too much thyroid hormone. The most common cause of hyperthyroidism is Graves' disease, otherwise also known as exothalamic goiter. Now, this is an autoimmune disease that is characterized by thyroid-stimulating antibodies that target the TSH receptors on the thyroid gland. It is also known as exothalamic goiter because one of the distinguishing hallmarks of Graves' disease is that many of these patients will present with these big, bulging eyes. You know, the kind of eyes that you see in patients when they all of a sudden realize they have an exam to do tomorrow. Under normal circumstances, our body is very good at regulating the amount of thyroid hormone that's in the blood. And the body does this through a negative feedback mechanism. What essentially happens is, as levels of T4 and T3 rise in the blood, the anterior pituitary is inhibited from secreting any more TSH. This will basically inhibit the thyroid gland from secreting T4 and T3 into the blood. In Graves' disease, however, you have these autoimmune thyroid-stimulating antibodies that are able to activate the TSH receptors on the thyroid gland and causes them to release a lot of T4 and T3 into the blood. So this is what causes the hyperthyroidism. Now, I want to go back to this slide briefly to talk about this enzyme called deiodinase. This is an important enzyme to remember because of its function in the peripheral tissue. It converts T4 into T3. Now, for those of you who remember this from endocrinology lectures, T4 is much less potent than T3, which means that in order for the body to utilize T3, it needs to first convert it, and this is exactly what this enzyme does. Also, keep in mind that 90% of thyroid secretions are in the form of T4. This is an important note to remember. Now, moving on to another cause of hyperthyroidism is a disease known as toxic nodular goiter. This is basically caused by benign adenomas in the thyroid gland. Now, do keep in mind that one of the differences between this and Graves' disease is that patients with toxic nodular goiter do not present with exothalmia. So what are the treatments for hyperthyroidism? I like to categorize these treatments into two main categories. One is you can obliterate the thyroid gland via radioiodine, or you can inhibit synthesis via thyrourulins. So let's talk about radioiodine. Radioiodine is taken up to the thyroid gland and incorporated into thyroglobulin. Now, as you probably know, radioiodine is radioactive, which means that it emits beta particles that kill the follicle cells within the thyroid gland. Now, this is a pretty radical treatment, and as such, it is only used in severe cases of hyperthyroidism and in some cases of relapse. More often, however, we use this class of drugs known as thyrourulins. How do they work? Well, all of them will inhibit an enzyme known as peroxidase. Peroxidase is an essential enzyme that is required in order to iodinize iodide into iodine. So if you inhibit peroxidase, you will ultimately inhibit the synthesis of thyroid hormones. Now, there's a drug within this class that you should probably memorize, and that is propylthiouracil. Propylthiouracil not only inhibits peroxidase, but it also has an effect on the peripheral tissue because it also inhibits deiodinase. Now, finally, there's another form of method that you can use to treat hyperthyroidism, and that is to give the patient a high amount of iodine. For some unknown mechanisms, it appears that if you give patients a high amount of iodine, it actually temporarily inhibits the thyroid hormone from being released. So now we're going to talk about hypothyroidism. The most common cause of hypothyroidism is Hashimoto's thyroiditis. Now once again, this is an autoimmune disease that is caused by antibodies that target the thyroglobulin. Now unlike Graves' disease, these antibodies will actually destroy the gland and inhibit thyroid hormone synthesis. Another cause of hypothyroidism is thyroid ablation. And this is commonly seen in patients that have thyroid tumors, in which the only treatment available is radioiodine. Fortunately, hypothyroidism is relatively easy to treat. Essentially, we just give them T4 and T3. An example of this drug would be levothyroxine, which is synthetic T4. So that basically concludes our session on thyroid disorders. In our next video, we're going to talk about bone disorders, as you can see right here. But as always, if you have any other questions, please post it in the comment below, and we'll try to get back to you as soon as possible. Thank you.